Good afternoon, and thank you for joining us today. This briefing is being aired live on YouTube. A reminder, to maintain audio quality, please keep your phones on mute until it's time to ask your question. If you are able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-Designee Andrea Palm, Dr. Ryan Westergaard, the Chief Medical Officer with the DHS Bureau of Communicable Diseases, and Ryan Nilsestoon, Chief Legal Counsel for the Governor's Office, are here to answer questions as well. We will begin the briefing right now with remarks from Governor Tony Evers.
Good afternoon, folks. Thanks for joining us today. Today I'm happy to report that the Wisconsin Economic Development Corporation received almost 31,000 applications for the We're All In grant program and began sending payments to businesses this week. These funds will be critical as they are targeted towards Wisconsin's small businesses and the folks who need it the most. WEDC staff from all departments are working to verify information with individual businesses as quickly as possible and hope to have everything completed by the end of summer. If you applied for the grant program but haven't heard from WEDC yet, they will be in touch. In addition to working on the We're All In grant program, the Wisconsin Economic Development Corporation released a report on the economic state of the state as we continue to battle COVID-19 and lays out some priorities for future economic success. One of the top priorities outlined by WEDC is the need for high-speed broadband access for every business owner, farmer, worker, and student moving forward. Overnight, as Wisconsin schools shifted to virtual learning and a large number of people began working remotely, we changed how we live, work, and learn in order to adapt to this virus, which has highlighted the digital divide in our state. Now more than ever, a strong state's economy is closely linked to access to high-speed broadband for our schools, businesses, and homes. That's why I'm proud that in our last budget we are able to make the largest state investment in broadband to expand our broadband expansion grant program to reach more underserved areas of our state. And today we announced the Governor's Task Force on Broadband Access, which will be tasked with going beyond funding and finding innovative, creative solutions to the broadband disparities in our state. This group was comprised of industry leaders and various stakeholders from across the state, and I look forward to their good work this summer and this fall. Because broadband access is not a luxury, but a necessity, especially as we continue to navigate learning and working through COVID-19. At the end of the day, what the WEDC report shows and what we knew already is that there isn't an industry or region that doesn't have challenges ahead. The COVID-19 pandemic has impacted every corner of our state, every household, and every industry, and the people of Wisconsin deserve a productive effort from local and state and federal leaders. One way we're doing that is with our Roots to Recovery program, which invested $200 million of CARES funding to reimburse local governments for the expenses incurred to address their COVID-19 recovery needs. The first round of expense reports are due tomorrow, and reimbursement payments will shortly follow so our local government partners on the front lines can continue supporting their communities and promoting local economic recovery. Wisconsinites are resilient, and I know that if we can continue to put the health and strength of our communities first, we can bounce back together. And this challenge belongs to all of us. The economic recovery of our state depends on our public health efforts. Every day, our administration, the Department of Health Services, and the Wisconsin National Guard are working tirelessly to contain the spread of COVID-19. We have conducted more than 650,000 tests across our state, and unfortunately, over the past couple of weeks, we have seen positive cases of the virus increase at an accelerated rate that cannot be explained solely by our increasing testing ability, with some of our record daily increases in the last week. We need to get back to working together to flatten the curve so our healthcare systems don't become overwhelmed, as we have seen in states across the nation where doctors are making difficult life and death decisions for their patients. The situation is still serious, folks. Fall is right around the corner, and believe me, I am as worried as you are about what school is going to look like for our kids and educators, whether or not we're going to get to watch the Badgers play, and how seasonal businesses will operate safely. But the good news is that we have the opportunity now to set the stage for later. As I said last week, it's all on us together to take responsibility for our role in reducing the spread of COVID-19, and we need everyone to continue doing their part by staying safer at home whenever possible, practicing social distancing, and wearing a face mask whenever they go out in public. Without a vaccine in sight, these are the best tools we have at this time to not only save lives and prevent hospitalizations, but to ensure our schools, our workplaces, and our local businesses and our communities can stay open. I know some will try to make wearing a mask a political issue, but it's a public health issue, and it's certainly an economic issue. So wear a mask, not only to protect your own health, but also the health of our frontline healthcare workers, small business owners, essential workers, first responders, and many more of our neighbors doing the critical work to keep our communities up and running safely. And now I'll hand it over to Secretary-Designee Andrea Palm for her COVID-19 update. Secretary-Designee, it's all yours.
Thanks, Governor. Good afternoon, everybody, and thanks for joining us again today. And today I will start out with our numbers. The death toll here in Wisconsin has reached 826. There are now 37,906 confirmed cases of COVID-19, which is an increase of 964 over yesterday. In the past week, we have increased our cases by 5,350 and broken our previous record for positive cases 4 times, including today. These numbers are not the result of more testing. In fact, on Saturday, we saw more positive cases than we saw on Thursday, even though we tested half as many people. Our percent positive remains high, and these numbers are the result of significant community spread here in Wisconsin. What does that mean? It means we need to double down on protecting our families and our communities. It means staying home and limiting our trips to the essentials. Wash your hands frequently, practice physical distancing, and wear a mask if you can do so safely. Another way to protect your community is to get tested. If you have any symptoms, even mild ones, or if you don't have symptoms but you know that you've been exposed to COVID-19, please access a test. Call your healthcare provider or go to one of our community testing sites. We know Wisconsin has community spread. We know that people with mild symptoms and people who have been exposed and are positive but asymptomatic can and do spread the virus. In fact, we know that people who are mildly sick or asymptomatic are more likely to spread the virus in the community than people who are severely ill, because those folks are less likely to be interacting with large numbers of people. And that is why minimizing your interactions with others and getting tested if you need to is so important. Wisconsin summers are beautiful. Businesses are opening up. Taking all of these precautions is draining, and it's easy to get discouraged and tired. It's easy to let your attention slide, to accept the invitation to that barbecue, or to gather some friends for a drink. But again, this is what we know. We know that gatherings as simple as barbecues and bars can and have spread COVID-19. And we know that the virus goes beyond those first few people who are infected. An infection at a barbecue can quickly spread from those attendees to their daycare provider or to a coworker or other relatives. And the biggest danger is that one of those people is vulnerable to severe illness or death from COVID-19. That is what community spread means, and it can quickly become difficult to trace and box in. It makes it much more difficult for local public health departments to stop the spread. It means that you are at risk, but together we can choose to reduce our risk, to take precautions and help keep our communities safe, including our essential workers and our healthcare professionals. These are our choices. And we see our cases climb here in Wisconsin. Now is the time. We need to work together again to flatten the curve and stop the spread.
Thank you. We will now open this up to questions. A reminder to maintain audio quality, keep your phones on mute until it's time to ask your questions. In the interest of time, please only one question per reporter. And we will begin with Scott Bauer from the Associated Press. Scott?
Hi, thanks again for doing this call. I had a question about the number of tests that have been given in recent weeks. The Badger Bounce Back Plan set a goal of 85,000 a week, and over the past 14 days, not counting the numbers you just reported, it looks like we had 70,000 last week and 61,000 the week before, nowhere close really to that 85,000. What effect is that having? Why are we not hitting that number, and what's being done to try to get up to that goal?
Thanks, Scott. That's a super important question. I think there are a couple of things going on here. One, we certainly have seen increased demand as we have seen a surge in the state. And our community testing sites that the National Guard are staffing for us are busy. They're very busy. And so it continues to be our goal to meet the 85,000 a week. It continues to be our goal to build beyond 85,000 in anticipation of the fall. But I think the other thing that people need to remember and understand in context here is that our capacity, our lab capacity, is actually about 170,000 tests a week. We, within the state of Wisconsin, if we ran 170,000 tests, we would have labs to process those tests. And so while we continue to encourage people who have mild symptoms or who have been in close contact with a positive case to get tested, we have continued to build the capacity across the state so that we can continue to encourage people who need to get tested, and that we can continue to have the capacity in our labs across the state to run those tests.
All right, and now we'll go to Molly Beck at the Milwaukee Journal-Sentinel.
Hi, Patrick Marley. I'm filling in for Molly. She was unable to join us today. Thanks for having this call. Governor, I wanted to ask you about schools. Do you want to have in-person school this fall, or will you order schools closed as you did in the spring? And if you haven't made up your mind, when will you make that decision, given that schools are to open in about a month?
Yeah, and I anticipate that schools will open by early September. And that leads me to something else that just has to be said. Clearly the surge and the numbers are increasing. And if we do want schools open safely, we need to all get behind it. I know not everybody has a kid in school, but you also know how important schools are to our future and the quality of life in this state. So whether you have your own children or not, I'm really encouraging you to take it easy, be as safe as possible, wear a mask, don't get into small rooms with a whole bunch of people that don't have masks, and help us make sure that schools open safely. The schools did receive information from the Department of Public Instruction, which coordinated not only with the Department of Health Services, but with education groups all across the state. Laid out several different options for people that are people locally can use to make the decisions. It's going to look different in different parts of the state. And we're already seeing it. Milwaukee Public Schools is looking to start the year virtually and then morph into a more regular situation. But I believe that we can open schools, and so I am not in any position to say we're going to or we're not going to, and I'm going to order them closed. That gets at an issue about what orders I can do or not do, but I'm still optimistic that they can open, and there's lots of options. But if people really want those schools to be open, we all need to pay attention to it and pay attention to our own health, and then I think it'll be much easier for them to open safely.
All right, our next question will come from WKOW TV in Madison, Danny Maxwell.
Hi, I just wanted to follow up with the testing capacity, but specifically we got word today from a lab that does testing nationally, but also locally here in Wisconsin, that they were seeing the demand so high that their turnaround time for results is going up and up. In fact, they say for non-priority tests that their results may take 7 days. So I'm wondering what the reason for this high turnaround time is for some of those labs, and do the results even matter after 7 days or more? Are they kind of moot after a certain time period?
Mm-hmm. It's a great question, and we obviously, it's part of why testing has been a priority for us, and within that priority, right, diversifying the technologies that we're using in testing so that if you have a supply chain issue with one technology, one particular kind of reagent or one particular other kind of supply, that we have diversified the kind of technologies we're using here across the state to minimize those kind of impacts. I think we still absolutely have a vulnerable supply chain when it comes to testing, and we continue to track that closely. But it is also why we have really tried to build capacity within the state of Wisconsin, because I think what we know is that the majority of our tests are resulting in under 2 days, and that some of the labs that different systems or different folks are partnering with that are out of state are having a real crush of demand, like you suggest in your question, and that demand really is driving their turnaround times 7 days, 10 days, and into timeframes that do make it less meaningful, because, right, the goal is to have good turnaround times so that you can get to that contact tracing piece of this really quickly, because it is chasing those contacts, making sure they understand how to safely isolate, quarantine, get tested, do the things they need to do to help stop the spread that is, you know, part of, right, how we box in this virus. And so that whole continuum of priorities are things we have been focused on, we will continue to be focused on, but I do think it is part of why we continue to want to expand our capacity here in the state of Wisconsin, because we want to make sure that within the four walls of this state, we can continue to maintain turnaround times that allow us to do this work well. And as your question suggests, the higher the demand, the more taxing that is for labs, and that can potentially impact turnaround time. So we're focused on that. We do want to continue to build our capacity within the state so that we can do everything we can to keep them as low as possible. But I do think from that perspective, if folks are not getting results timely, I would encourage them to call. Sometimes there are anomalies in the tests, or you know, there are human error in the entering of the data. Maybe your phone number got transposed. We've had trouble reaching you. So if you are somebody who is seeing test results beyond 5 days, I would encourage you to call, just to make sure that something hasn't slipped through the cracks. But I also would encourage folks on the front end, ask if your test is being shipped out of state, and then you can make an informed decision about how urgent and whether you need to think about seeking a test that will be processed within the state of Wisconsin.
All right, our next question goes to Katie Anderson from WBAY in Green Bay. Katie? Katie Anderson? All right, let's move on. Sean Kirkby at Wisconsin Health News. Sean, are you there?
Hi, thank you for holding this. I was wondering, could you provide any update on where the state is on hiring more contact tracers and whether or not that's meeting the demand is with the current surge? Thank you.
Mm-hmm. Thanks, John. I think I might have mentioned this in our last briefing, but it's hard for me to remember, so I'll say it again if I didn't say it already. We are in the process of hiring an additional 30 contact tracers at the state as LTEs. We did see, understandably, a little bit of attrition, and so we were looking to get back up to our 200 number that was our target initially, to make sure we were able to provide the kind of support to counties and local public health as they were seeing surges or seeing upticks and needed us to wrap around and provide that support to them. We are receiving requests daily for assistance with contact tracing, which we are continuing to provide, and through our pretty regular contacts with local public health, understand them to be handling their surges or their upticks or their caseloads, their need, and if not, are asking us for assistance. So we'll continue, obviously, to monitor that, and we'll pull more people in as we need to off our LTE hiring list, and continue to supplement what is happening at the local level. We also did, through the CARES Act, provide money to locals to bulk up their own contact tracing teams, and so they are also doing that work, again, to make sure that they're able to flex and do the contact tracing they need to at the local level.
All right, and our next question comes from Bruce Marcus at
Sorry. Excuse me, this is Katie.
All right, Katie, why don't you go ahead?
Hi, sorry. Thank you for taking my question. I am curious, are all hospitals and labs able to do antibody testing? And if so, what's being done to encourage people to get an antibody test, since those who are asymptomatic seem to be an issue, and as you said, those who are asymptomatic are more likely to spread the virus?
Yeah, so I'm going to let Dr. Westergaard dig into the science here, but I think that it's important to understand that whether you are symptomatic or asymptomatic, you should be receiving a diagnostic test. An antibody test is not the test we're recommending to determine whether or not you have COVID-19, but we are doing some work in the antibody space that I'll let Dr. Westergaard dig into.
Yeah, that's right. Our efforts around using antibody tests are really on the research and epidemiology, or the surveillance side. So there's good reason to know on a population level how widespread has the epidemic become. So we at the state are systematically screening people throughout the state through several different projects to understand how many people have antibodies as something that reflects past infection. But I think the point that Secretary Palm made is the important one, is that antibody tests don't tell someone if they're infected now. They don't tell us whether they're infectious or contagious. And the other thing is, it doesn't tell us whether people are immune or protected from future infection. So really, those tests are a useful marker of being infected in the past, which can tell us some useful things, but they're not in the same category as the diagnostic tests, which are the ones that tell us whether someone's infected right now.
All right, and now we will head to Bruce Marcus with WRJO in Eagle River. Bruce? All right, we'll try to get back to him later. Let's move on to Aaron Mabin from WITI Fox 6. Aaron, are you there?
Hi there. Yes, I'm here right now. You know, there's a lot more mask wearing in our area with these mandates happening, and a lot of people have questions. So I want to know, what is the number one thing you want people in our area to know when it comes to mask wearing 101, cleaning up the mask, when to get rid of it, all of that stuff?
Yeah, I'll let the doctor run the...
Sure. It's a great question. You know, as we've learned more, we've learned a lot more things about this pandemic as we've gone in the past 6 months in a large range of areas of science. But in terms of infection prevention, we've learned about the ways in which face masks, both the medical grade PPE masks that we wear in healthcare settings, and also cloth face coverings in the general public, they've really emerged as one of the most important tools. So we encourage, we support everyone to take mask wearing as an important strategy on an individual level. Communities, organizations, businesses, universities who want to have mandates for people to make it a sort of the normal behavior among people in their facilities and their organizations. It's a very important strategy. So in terms of the individual behavior, what is it? You know, wearing a clean mask every day is important. Medical grade masks, generally in healthcare, we require some training on how to put them on and off. So if someone is an employee at a long-term care facility or a hospital or a clinic, they should get proper training on how to put on the different kinds of masks. In general, though, for the general public, the cloth face coverings, as long as they're clean and they cover both the nose and their mouth, and you wear them, particularly anytime that you're within close contact with someone, it should have a good effect. The most important thing is keeping the respiratory droplets and secretions, from getting out into the environment. So a clean mask, even if it's cloth and homemade, can have a big impact on that. So I would just say, consistency in wearing a clean mask, and try to avoid touching it, and realizing that when people touch their masks, that can also contaminate their hands. So it's not by itself the strategy, the most important strategy, but as a combination of hand hygiene and physical distancing, really tremendously important. So thanks for the question. It's something that we encourage everyone to do.
All right, thank you. Our next question comes from Rachel Glosh at TMJ4 in Milwaukee. Rachel?
Hi there. Do you believe Wisconsin is at risk of experiencing a large spike in cases similar to Florida, Texas, Arizona, California? What needs to be done right now to prevent that from happening? Thank you.
Thanks, Rachel. I think that's sort of the window of opportunity we have right now, right? Whether it was in March and April or now, we've been lucky in Wisconsin not to be on the leading edge, and we've had an opportunity to look around the country, whether it was Seattle and New York in the March-April timeframe, or whether now, as you suggest in your question, Arizona, Texas, Florida, other places that are seeing spikes and surges that are really taxing their healthcare systems to the point that they are having trouble effectively treating everybody who needs hospitalization. And so I do think that people should take very seriously the cautions and the learnings that we're getting from these other states. Now really is the time, because of the way the virus operates and the lag in time of infection to symptom onset to potential need for hospitalization and severe illness, right? There is a time lag. And so if we wait until we are in that situation, we will have waited too long. And so now really is the time to double down on our work together. We did such a good job in the spring of flattening the curve and protecting each other, protecting our vulnerable citizens, protecting our frontline healthcare workers. And it really is time to do that again so that we don't have to learn firsthand the lessons that Florida and Texas and Arizona and New York and Seattle did before them. And so I would encourage everybody to take seriously social distancing, physical distancing, wearing a mask, the good hand hygiene, limiting your interactions with other people, returning to a regimen where you are really focused on your essential errands once a week. So really thinking hard about how do I reduce my risk and making decisions that do in fact reduce your risk and risk to others around you.
All right, our next question, Amy Reed from News 3 in Madison. Amy?
Hi, Governor Evers. Are you going to use CARES Act money to help people who are still waiting for unemployment benefits? Thank you.
I saw that proposal, and we're looking at it, frankly, just in initial responses that was suggested by the Republicans. I view it as somewhat of a political stunt. I don't quite know how we're going to do it any faster using CARE Act. It's not as if we have a list of 300,000 people. Suddenly we're just to say, okay, we'll make a guess whether you're actually eligible. We'll send out a bunch of money. First of all, it takes human beings and an organization in order to physically do that. And second of all, it is risky just to send money out with no understanding of the adjudication process that DWD does. Yes, we are going to continue to work hard to make sure that everybody gets the unemployment insurance checks that they should get. We're making progress on that, and I'm looking forward to the day that everybody that deserves to get one should get one.
All right, our next question comes from Stephanie Hoff at WisPolitics. Stephanie?
Good afternoon, and thank you for taking my question. My question is for Governor Evers, and it's regarding that $10 million that the Democratic Party raised in the second quarter. What did you do personally to help pull in that money?
Made a lot of phone calls at night. Raising money isn't exactly easy, and I did spend a lot of time doing it. It is important work to do in order for us to have a government that seeks bipartisan solutions to thorny problems. That has been lacking since I become governor. Republicans are not interested in cooperating on a whole number of issues. And so, yes, I did spend a lot of time. It's really important work. I think if we want to have fair maps in the state, if we want to accomplish a lot of the things that the people of Wisconsin have asked us to do, we need to make sure that our government works well. And I believe that one of those ways is to make sure that I still have a veto after next November, but also have some success at the polls too.
All right, the next question belongs to Savannah Tomei from Spectrum News. Savannah, are you with us? Savannah Tomei? All right, let's move on to Eric Gunn from the Wisconsin Examiner. Eric?
Thank you for taking my question. I want to alert that the moderator's voice keeps breaking up in the call. That may be not something you can do anything about, but I wanted to alert you of that. My question is probably primarily for Dr. Westergaard. In addition to people who simply recover from COVID-19 or people who die as a result, what kind of details and data are emerging for you in the state about post-COVID recovery problems, maybe even long-term problems such as permanent heart damage, lung damage, strokes, neurological damage, and that leading to either weakness and loss of coordination or loss of cognitive function. Have you developed any kind of data in terms of what numbers of people may be experiencing those kinds of after effects?
Sure. Yeah, thanks for that question. There have been some peculiar things that we've learned that can correspond with the syndrome of COVID-19 that are somewhat atypical compared to other respiratory viruses. The two big categories that those fall into are immune system phenomenon, like there's a condition called vasculitis where people can get unusual rashes or blood clots and blood clotting disorders. So this has been described as a number of recent publications that show how, in addition to causing direct damage to the lungs and the airways, this virus can stimulate the immune system to do damage to the body in some rather unusual ways. I would say it's too early to have long-term data on how much long-term morbidity or long-term consequences related to those things are. They're definitely a minority of the cases have these unusual things. The other thing in children, of course, we've talked about is this multi-system inflammatory syndrome in children. There have been a number of cases of these. These tend to be rare conditions, and the majority of people with COVID-19 have a full recovery. I think the proportion, estimating the proportion who don't fully recover or who have some lingering disability from this is going to probably take some time to understand, but it's definitely a small minority. Most people get all the way better.
All right, our next question from Abigail Hankey, NBC 26 in Green Bay. Abigail.
Hi, my question is for Secretary-designee Palm. Now, last week we were talking about more than 24% of new cases were coming from gatherings like bars. Now, my question is, where are the other 80% coming from? So in other words, are there any trends you can talk about to kind of help people understand how it's currently spreading if 80% is outside of that gathering category?
Mm-hmm. That is a great question, and I, off the top of my head, will tell you I would need a little help from Dr. Westergaard if he's prepared.
Sure. Well, I'd say a big category still at the time that we purport the data are missing. So we have incomplete data related to all of these exposures. But I would say that without specific proportions, the other large categories are household contact. So people that live in close contact with each other. If someone develops an infection either at a workplace or at a gathering, transmission to household contacts is still common, and that speaks to the risk of people transmitting virus early in the course before they have symptoms, before that they have been tested, and we still are actively monitoring a number of outbreaks in workplaces as well. We've done relatively well with long-term care facilities. We still have, I think, about 60 active investigations, which means there's cases that we're trying to stop transmission and investigate. But those numbers have been small, limited to one or two patients or residents. So it is a wide range, and it's difficult to have a precise estimate just because the data are imperfect, and it's challenging to get all the data in a timely fashion. A lot of our public health departments are making many calls, tend to have a backlog of investigations that they need to do. So we're focusing on the most critical, essential information, which is, are you able to become isolated, and who are the individuals you've been in contact with to support them. So they're doing the best they can, but there's going to be some imprecise thing about the overall proportions.
All right. Our next question, also Green Bay, Ben Krumholtz, WLUK. Ben.
Hi, thank you for the opportunity. My question is, has Wisconsin considered a travel advisory list similar to New York, and why or why not?
Well, we're on New York's list, so I guess we'd have retribution and say they'd have to do the same. Those travel advisories are almost impossible to follow. I mean, if you're flying into a city, a big city in like New York City, you're able to do something around that. But our state has so many roads and other ways to move in and out of our state that it seemingly is impossible to enforce. So I don't anticipate having one of those dealing with that issue. My goal is to get off of New York's issue. Not that I want people to travel to New York, but if they put us on their list and they're thinking that we are having surges here, which we are, and the sooner people work together to make sure that they're wearing a mask and that they're keeping distance, appropriate distance from each other, then we can get off of their list.
All right, the next question comes from Mitchell Schmidt, Wisconsin State Journal. Mitch.
Yeah, thank you all very much for the call today. You preempted me on the New York order. I was just kind of curious if you might be able to talk a little bit about, I mean, do you feel that that's a warranted response from the governor of New York to add Wisconsin to that list, especially in light of the increased cases that we were talking about earlier? And then the only other one was just kind of curious what sort of impact, if any, that may or may not have on the state of Wisconsin. Thank you.
Yeah, I'm guessing not much. I mean, certainly economically and personally, people have ways to interact with folks in New York City and the state without actually traveling there. So I'm not sure that it will have much of an impact at all. I just think that we should use this as a motivator to continue to do the best we can and actually increase our ability and our participation in having masks and keeping socially distant and staying home as often as possible.
All right, let's go now to Amy Fluxoff from WMTV. Amy, are you there?
Hi. Yes. Thank you for taking my call. This message is for Governor Evers. I know you talked about not making a statewide mandate for whether opening or keeping schools closed, but with so much uncertainty right now and we're so close to the start of school, many parents are both working and need to be making decisions. What advice do you have to parents right now as it stands? What can you tell them to kind of help plan for the fall?
Well, absolutely. First of all, they should be in direct contact with their school districts who are making that decision of how to open up. Our role in this would be to, if things are completely out of control, to suggest that they not open. I'm not sure that there's the ability anymore from the state level to make that decision anyway. But the bottom line is parents should plan. Your school districts are saying it right now. They plan to open. I see it all across the state. So they need to be in contact with their local school districts. Child care is obviously an important thing. I know that back in the days, but I would be prepared to send your children to school.
All right, let's go now to Jeremy Janine from Urban Milwaukee. Jeremy?
This question is for the DHS personnel. Last week you said other states with greater outbreaks gave us an opportunity to learn from what was happening. What have you learned in the past week?
So I will also or ask Dr. Westergaard if he wants to add anything, but I do think, right, like the spring, similar to now, we are seeing outbreaks in states around this country that we certainly don't want to get to that point. And so we need to do the things that are necessary to reflatten the curve and to prevent ourselves from getting to the place where our hospital systems and our frontline healthcare workers are really unable to meet the demands of patients that need hospital level care. And so I think it's as simple as that. We can look to folks who are a few weeks ahead of us, recognize that this virus means business, that it spreads rapidly, that it continues to be contagious, and then do the things together that we know we need to do to stop the spread, flatten the curve, and not get ourselves in a place that is really difficult to manage. But I don't know if you have specific scientific lessons.
The link between social interaction and particularly close contact, particularly indoors, and disease transmission just gets stronger and stronger. You know, we always presumed this would be the case because what we know about respiratory viruses in general, but we're seeing the same story get told, is that when people interact more in indoor settings and don't wear face masks and larger numbers of people get together, that drives transmission. So we haven't learned this. It wasn't something that is surprising or that we didn't know to be true before, but the evidence continues to get stronger, and the more we see it, with the more certainty we can make these recommendations that these are the things that we need to do. We need to wear masks when we're indoors. We need to limit close contact. It's going to make, and frankly, those are our only tools right now. So the story is getting stronger and the evidence is getting stronger, and we're learning that those lessons over every day.
All right, our next question comes from Hillary Mintz at WISN. Hillary?
Yeah, Governor, getting back to the New York travel advisory, I know you said it seems like it's impossible to enforce here in Wisconsin. It seems also that it's more about sending a statement. So why is that something that Wisconsin is not interested in doing as far as other states? And what does Wisconsin have to do to get off of New York's hotspot?
Well, we have to mitigate the virus in the state of Wisconsin. It's important that we do all the things we've all said probably 15 times today and do it well. and then we will be in a better position. Our positivity rates will be down, or the numbers will be down, and frankly, the hospitalizations will be down. And then we can probably get off of Governor Cuomo's list. But yeah, sending a message. So we send a message, and just how is that enforced? You know, I guess I can honestly say that I never realized that was a significantly important tool in a toolbox, and if I need to rethink that, I will. But you know, we have how many roads cross in between here, Iowa, Minnesota, Michigan, Illinois, and do we set up stoppages at every road and take temperatures and maybe do a quick test to make sure that people are okay to come in? There reaches a point where that has, frankly, no practical value and, frankly, no messaging value.
All right, thank you, Governor. The next question, Steve Prestegard, the Platteville Journal. Steve?
Thanks for taking my call. Our newspaper has been covering over the last couple of weeks how schools are dealing with, you know, the decision of having classes in person in September or not. And one of the issues that school superintendents have come up with that are concerned about is whether or not they're going to get the state aid that they would typically expect to get this fall. There's the third Friday count in September, of course, and I think there's more aid perhaps that comes up before school districts figure out their budgets. They're also concerned about kind of expenses they can't really anticipate in areas like staffing if they need smaller classes and tech and that sort of thing. Is there anything that you support, Governor, as far as either a temporary or not so temporary increase to school districts in aid that would come from the state to help those sorts of issues?
Well, certainly the amount of state aid going to school districts in the budget for next fiscal year is an increase, pretty significant increase in a number of areas. So it's our plan to do whatever we can as we look at cutting our budget to minimize and maybe hold harmless money that leaves the state and goes into the municipalities or school districts and so on. That's always been our goal and will continue to be our goal. To go above any increase of that, I would say there's very little chance, because our revenue sources are drying up just like everybody else's. But what we're doing is making cuts to state government to do whatever we can to minimize the threat to state aid to school districts. The other thing that's hopeful is I was on a call with Vice President Pence yesterday, and he was talking about the next round of money coming from Washington, D.C. would likely have money for schools to deal with the issues that they need to deal with as they get ready for the next school year.
All right, and our next question from Victor Jacobo from CBS 58. Victor?
Hello, good afternoon. Thank you again for taking the call. And my question is about CARES Act funding and kind of building off, Governor, what you just said about your conversation with Vice President Pence. I was wondering, you know, what's the status currently of just current round of CARES Act funding, where you see the remaining funds going, and what's the conversation with the Wisconsin congressional delegation in Washington as next week they return from the recess, and obviously that conversation is going to be happening. So I'm wondering what the priorities are that you're having with the congressional delegation to help the states for what may be the next round of funding. Thank you.
Yeah, and we are the National Governors Association that I belong to, as well as other organizations, plus our own work with the congressional delegation, is to the next round of CARES funding to have money to assist local municipalities and state governments in remaining somewhat whole during this time of difficult revenue. And so that is there, and certainly we would support the additional money for school districts also. So those are the areas that we're working on, and hopefully we'll have some success in that area.
All right, and we have gone through our list, but we did have 2 reporters not available. So let's try to call one more time on Bruce from WRJO. Bruce from WRJO. Okay, what about Savannah from Spectrum News? Savannah from Spectrum News. All right, well, with that, let's conclude today's briefing. We want you to all please to continue to monitor the DHS COVID-19 web pages for data and for guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, and the Department of Children and Families and Wisconsin Emergency Management. Be safe and have a great afternoon.